Anyway, I appreciate the participation, and I would like to sincerely congratulate Professor Ali Mozalal, and of course, one of the founders of the university hospital courses, which is Professor, my good friend Yves Krasas, which, by the way, Professor Muzalal, I spoke to him yesterday, and I was so happy to talk to him. And your effort, it's very, very important for educating doctors around the world. What is very interesting is there are very few universities around the world that train and teach hair restoration. There's so many students, there are so many men and women who need to have a proper treatment, and yet very few universities offer this education. So anyway, congratulate you all, and today we'll tell you a few words of how DHI contributes to what you're trying to do. How do we contribute to education in hair restoration? We contributed, we actually started the first academy in hair restoration. It's called London Hair Restoration Academy, and you can participate online, and of course, live sessions, hands-on sessions, and seminars. So through the academy, we created innovations that are very unique worldwide. And today we'll speak about the future. We'll speak about, for UC live sessions, live diagnosis, and we'll speak about the future, what we're going to present in the end of June at our master's meeting, that of course you're all invited. And fun enough, the even medical technology, let's call it medical technology or medical treatment, it goes to the direction of AI. So the main topic of DHI at the master's meeting is DHI AI. One of my partners said, don't call DHI AI, call DHI. Anyway, so this is what we're going to discuss. But before we go to DHI AI, Dr. Vasia Biru, our Global Medical Director, she will show you an actual live session. And by the way, we now do up to 10,000 hairs in one day. Imagine, we started with 500 hairs a day, and now we do 10,000 hairs a day. And one of our future, besides the DHI AI, is the hair unlimited. Is it possible to extract unlimited number of hairs from donor area? Tomorrow we have a very big VIP who's coming to have chest and beard hair because his donor hair is limited. So this is also the future for us, hair unlimited, 10,000 hairs and AI. So let's go to see a bit of a live session, diagnosis and treatments, and then we'll go back to close the presentation with your questions.
Okay, give me 2 minutes in order to go to the session room to show you a bit of our DHI implantation. And then we have also live diagnosis for you. And I will show you also all the instruments that we are using for the hair transplant. Give me 2 minutes and I will be back with my camera on. We are here in the session room. I'm going to show you a live implantation right now. Thank you, Sophia.
And you can ask questions, any questions you like when watching this.
As you can see, it's the recipient area is totally unsaved. So our doctor here is going in between the existing hair. And we follow our very strict protocols regarding the angle and the direction of the hairs implanted.
Because direct hair implantation, the most important part is the direct hair implantation. To do direct in the right angle in the right direction. That's why it's called direct hair implantation. And that's the most important part of the hair transplant. It's not how many hairs you do it, it's how you do it. And this technique shows you exactly how you do it in the right direction, in the right angle, and that's how you receive good density, but more important, great results every time.
Now you can see here actually our nurse, because for DHI, the nurse's job is very important actually. They are the ones who are taking care of the grafts. See here actually, the grafts are implanted one by one in these special instruments that we have that we call implanters. And then our doctor is taking and is placing again one by one all the grafts.
It's a very important of us here because they're part of the SOPs and they're very, very important.
Now I will show you actually a very, very dense packing actually. If you can see, I don't know, let me show you, Grigori.
Sorry, I'm sorry.
Look how dense the implantation is here. Please go on. And
hair restoration is both art and science and medical procedure. And that's why it's not taught at universities, because it combines the art, the science, and the medical procedure, and very few universities, except Lyon, offer these courses.
let's go then to, perhaps we should start, Costa, with our presentation. And in the meantime, I will show you a live diagnosis. Actually, before we go to the presentation, I would like to show you the online training and what you can use for the online training. So here we have our Oculus, our DHI VR system. I would also like to show you our unique, actually wireless extractor machine, which is this one. And here you can see the pans that we are using in order to extract the grafts one by one. And then again, I've showed you already the implanters that we are using in order to do the implantation, to implant the grafts on the scalp. Everything in DHI is single used. So whatever we use after the session, we destroy them straight away in order to have the best possible safety and hygiene for our patients.
Quickly show the presentation, and I think it's also very important for the doctors here to understand that hair restoration is not just about hair restoration, it's about life itself. It's about understanding the science of hair, the art, and the aesthetics, and the responsibility to have this that we have to our patients. And this is what the DHI is the global leader, because we have spent 55 years to create these innovations. So show us quickly the presentation, Costa.
So this slide is very important, is our academy, our London Hair Restoration Training Academy, the first and only academy in the world on the field of hair restoration. We have online programs as well, as I showed you already, the VR program. Thank you, Costa. So, as Mr. Giotis said already, DHI is the global leader in hair restoration. And why is this? Because of our 55 years of commitment only on hair restoration and nothing more. We have global presence with 75 clinics around the world. We were the first to introduce FUE globally and then abandoned FUT. We have the most advanced diagnostic system of hair and scalp disorders, the DHI Total Care System, our academy, The direct hair implantation, more than 250,000 patients. We have a patient education program, and we have university diploma for healthcare professionals in Lyon and in University of Athens. The DHI total care system that includes the diagnosis, the prevention, and the restoration. So the DSA, what is the diagnostic system of alopecia? What does it include? It includes dermatological examination, psychological and medical aspects, mathematical aspects, and the future hair loss prognosis, together with the DHI VR and the DHI simulation program that I'm going to show you later on. Here is the DHI AI simulation application. As you can see, we have the before and the after. The after is a simulation. It's not a real result. We are using this program so that all our patients can see how they are going to look after their session. So apart from the hair restoration, we are doing PRP therapies as well. I think most of you know what PRP is and how it can help not only on the hair loss, but on many other diseases actually of our body. Our brand new DHI range of products that includes lotions, shampoos, female shampoos, and antioxidant lotions. Thank you, Costa. So at the turn of the century, we were among the first to move forward from the harsh FUT strip and develop the FUE transplantation. The following years, we introduced the DHI, the direct hair implantation, a technique that transforms the hopes and expectations of our patients. Our founder, Mr. Konstantinos Giotis, was recognized as the father of modern hair restoration. So what are the main differences between the three techniques, DHI, FUE, and FUT? In DHI, we extract the follicles one by one. As you can see, in the other techniques, okay, in the FUT, in the strip, we take we make a big scar and we remove a scar tissue actually in order to cut the grafts and process them with tweezers and everything. The same is for the FUE technique that we use cutter and microscopes. In DHI technique, the follicles are implanted one by one, the way that I showed you in the session room, and it is performed only by doctors that were trained by our academy, London Hair Restoration Training Academy. Of course, DHI is the world's best hair transplant technique. It is powered by the triple synergy technology, teamwork, and technique, and it is offered exclusively by DHI Global Medical Group. Now, with our technique, we can do giga sessions in one day up to 10,000 hairs. Unshaven sessions, I showed you already the unshaven implantation. We can restore body hair, but we can also extract body hair, and we can do beard and eyebrow restoration. Now, this is the more advanced technique that we are working on, the direct in.
Hello,
technique.
hi Valentinos. Τι κάνεις, είσαι καλά? Όλα καλά? Πώς πας?
Kate, μπορείς να γίνεις mute. Okay, so here you can see a video of our direct in technique. We extract and we implant at the same time. The advantages of DHI technique It's absolutely safe, little or zero recovery time. It's a painless procedure. We have 100% natural results. It's done only by doctors, and we have safe and unsafe options. The direct in that we showed you before, it's only for small sessions, like we call them lunchtime session, up to 1,000 hairs. It's painless, again, only by doctors, and back to work next day. Now we will show you some of our amazing results before and after. Female hairline and beard restoration. One more of the services that we offer is the scalp micropigmentation. As you can see, there are some cases that either in combination with a hair transplant or even without, we have this instant hair restoration method for both increased hair loss and sparse hair. SMP is applied to the scalp across the region of dilution in the form of small dots or lines between existing hairs to present the illusion of a higher density, or on a totally bald scalp for a shaven look. We also have the hair systems. There are quite a lot of patients of ours actually that are not suitable for a hair transplant. So the hair systems is the best option for them, or even a combination. We can have a hair transplant in the frontal part of the scalp and combine it with a hair system only for the crown. And of course, Mr. Giotis' book, let's begin. And now, if we are okay, we will move to a live result after a year. Give me 1 second.
Okay, no.
This is the before we see or the after? Okay, now we see the result because I was confused. I thought I saw. Okay.
I see your microphone is off. We cannot hear you.
Mine.
Mine
we
was
can hear.
off. Okay, sorry.
Okay, so it was about 2016 that after lots of research, I finally concluded that DHI was the best place in terms of history, of methodology, of techniques, of expertise that I should come to in order to trust my hair transplant. So I came here along with Dr. Biru, and she took care of me, as you see, the before and after. I could say that the incredible thing is that I chosen the unsaved session with Dr. Biru. So when I came back to my house the same day, my wife didn't realize that I had done anything, as you can see in the photos. So I was actually really amazed by that. And after that, you can see the end result. I'm very happy with that. My psychology is, boosted. So all this played an important thing to trust my head in a transplant into the expertise of DHI.
Thank you so much,
Thank you.
Kyriakos. I think more or less this is it for us. Once again, I'm gonna stack on the safety actually of our procedures, and I will show you why DHI and what is the big difference actually. I cannot turn on my... Okay, I will show you now. I will show you actually the books that we have of our protocols. As you can see, we have protocols for everything, for the training, for the medical team, risk management, clinic management, marketing, everything. Mr. Giotis, if you want to add something more?
No, I have a question.
Please.
Why don't anybody ask us a question?
That's what I was about to say now. Now you can ask all the questions that you might have.
In French. Francesca?
Elise?
They didn't like what they saw. They didn't like it.
Any of the attendees, any question, please?
No, Vasya, they did not like it. So we have to do another meeting.
Now, straight away, for the next 30 minutes. Elise, any questions from your part? We cannot hear you. If you are muted, we cannot hear you.
Hello, do you hear me?
Hello. Yes, now
Yes.
we can hear you.
Okay, the issue is we didn't understand a lot the difference between the DHI and the FUE. So you are going to, you do the transplantation, you take the implants, and another one is going to do the transplant, because like, as you see, we are doctors, we came here to know, to get teach, to learn about it. However, what we saw, it's a little bit like a publicity, but we didn't see anything,
So,
any action. The purpose of here, we are doing university diploma is to see what you're doing. So is it possible to see something, or just?
I will show you once again the slide with the differences between DHI and FUE, and then I will go again to the session room to show you once more the live implantation. So as you can see here, the first technique is our technique, the DHI. As we have said, we extract the follicles one by one. The follicles are not processed at all, and of course we have the direct-in option. And then follicles are implanted one by one directly to the scalp without doing any reception holes, without using any needles, straight away with our implanters. We can control the depth, the direction, and the angle. And of course, it's performed only by doctors.
Make it simple for them to understand is they have to understand that FUE and FUT, they're very similar. The difference is that with FUE, the placement is exactly done the same as FUT. So in a way, FUE is half FUT. Well, DHI had changed the world, not only how you extract it, because you extract single hair follicles. On FUE, you extract double and triple hair follicles, and they put them at the microscope, and then they divide them into single hairs. So there's a difference of how we extract, but there's a huge difference how we place. We don't use what is called La Vida forceps.
Okay.
We don't use forceps. We use the DHI patented implanter, which controls the depth, the direction, and the
Okay. The implanter is it's like the champagne. There is a champagne that, or there's it's something completely different.
You can see here. Okay, Mr. Giotis, please go on.
No, it's an advanced kind of pen, but it's not a pen. It's an advanced pen. It's called DHI direct implantation.
Can you see it? Okay, any more questions?
And how could we learn this technique?
So,
Through the DHI Academy, you can learn online. There's an online program, and then, of course, hands-on in London or Athens.